Okay, now we talk about the phosphodiesterase inhibitors, which is another drug for heart failure and yeah, for heart failure. I haven't got to chest pain or anything yet, but it's another drug for heart failure and like cardiac dysrhythmias. So if there's only one drug that we need to know. I think there's only one drug in general for it, and it's just going to be the milrinol lactate, but a lot of people just say Milinerol, whatever it's called, and it's just I think it's like Perotec or something is the brand name. But anyways, so what we really need to know is that it promotes positive inotropic effects. So in the last video, we wrote down that positive inotropic effects. It increases and it has one decrease. So it'll increase the stroke volume, it'll increase the blood flow, it'll increase the contractility, and it'll decrease the preload, which is the heart stretching. And I searched that up from Google that the preload is just the heart stretching. Because remember, with heart failure, your heart, it enlarges and there's a decrease in contractility. So this would actually decrease the heart stretching out so much so that it can be like a balance or just to help out. And then we have stroke volume. It increases stroke volume again, and then it'll increase cardiac output. So cardiac output is how much blood is pushing out of the body in the correct motion. Because we know cardiac heart failure, you have left or right, and it's going back to either the periphery if it's heart failure, or right heart sided heart failure, and then it's going back to the lungs if it's left sided heart failure. All right, then vasodilation. You're just gonna have some bradycardia. They're at risk for bradycardia, and they're also at risk for hypotension, probably orthostatic hypotension too. And then you also want to make sure you look out for that whenever you insert or give this person a medication, it's going to be only intravenously, so IV, for no longer than 48 to 72 hours. And I'm pretty sure that was in the PowerPoint, but you want to make sure that they don't get this drug for no more than 48 to 72 hours. And you should also be on monitor for high alert medications. So like digoxin. I wouldn't even mix this with digoxin. Okay, so now over here, we have a little dumbed down list that helps me out. So contract means to pump stronger. So like when you think of contract, just think of like that little good squeeze to push everything out and for it to go really, really, really fast and And then we have decrease in afterload, which is just relaxing of the blood vessels, which probably is the vasodilation. And then it's a short-term treatment, remember, because we only give it IV for no longer than 2 days or 3 days. And then it can cause deadly arrhythmias if you have it in for longer, or if something in the body's contraindicated for it. And then you can have low blood pressure. I just put LBP because I don't want to write out the whole thing. Then you have angina, which is chest pain. I'll write that down actually, in case. So you have angina, which is chest pain. Then you have low potassium. Low potassium. Always check your electrolytes. That's what she say. Always check your electrolytes. So you might want to check for low potassium. Why? Because the main electrolyte that works with the heart is potassium. And low potassium, hypokalemia. Not hypocalcemia, hypokalemia. K, right here. I'll mark it. Hypokalemia. So yeah. And then you also want to do in case if it's like a clinical scenario type question, you want to make sure you monitor the blood pressure and the heart rate, because why? They have heart failure. If they have heart failure, their blood pressures might be a little bit too high and it might be off. Then you want to also check for the potassium levels. Why? Because the hypokalemia if they're having this medication. And back up to the blood pressure and the heart rate. If they are taking this medication, you also want to check them for bradycardia and hypotension. And then you want to also make sure it's only given intravenously, only given IV only. Only that. And you also want to watch for adverse effects. But pretty much this is it, just for the one drug. I hope this helped.